Hello. Good morning, everybody. How are you guys today? How are you doing today? So I am back with another video. So a lot of people keep asking me what exactly is on this risk adjustment exam. So yes, I still do tutor CPC. I still do teach CPC, but primarily I've been focusing a lot on the CRC. Just because, in my opinion, in a lot of coders that have both certifications, a lot of coders will let you know that the CRC is probably less challenging, especially if you've been coding. So that's why my primary focus has been the CRC, because it's kind of less challenging than the CPC, being that the CPC, of course, you can go back and look at other videos. It'll just give a description or kind of break down the difference in the CPC and the CRC. So as you know, the CPC has 17 different sections. CRC has about 9 different sections to learn. So I've been primarily focusing on that, helping people get their risk adjustment certification. So a lot of people has been asking me specifically, what are the things do I need to know for the risk adjustment exam? So I want to be a little more meticulous or tedious when it comes to giving you all of the categories or the things that you would need to study for the risk adjustment coding exam. So I'll go through each individual section to let you know just kind of like an overview of the things you need to learn and kind of like touch bases about what it is if you're unfamiliar with risk adjustment. Also, I'll drop the link below. A lot of times with wanting to learn a new skill, of course, sometimes you don't want to run out and go out and pay $1,500 for a new class or $1,000 for a class, a risk adjustment class, and you're not sure if you're going to be that intuitive, that committed, or that interested in it to spend that type of money. So I do have a risk adjustment study guide, and it's like a 3-hour audio and video that comes along with it. So what that risk adjustment study guide and video primarily was for is a lot of coders who have their CPC, who are already certified with other coding certifications. They were wanting to learn or know enough about risk adjustment coding to pass a pre-employment exam. For instance, a lot of times when you get hired for these risk adjustment jobs or these contract positions, they want you to do a risk adjustment pre-employment exam to make sure that you know how to risk adjust, code for risk adjustment charts. So they'll probably send over a time test. Sometimes there are 50 questions, sometimes there are 20 questions, or whatever it is. It's usually just a pre-employment exam to make sure that you are well versed in risk adjustment coding. So a lot of people have not entered that field of risk adjustment. So I took the time to make a 3-hour video and audio because I actually had a workshop about it. And a lot of people actually told me that they passed the exam just for coming to the 3-hour workshop. So I'll drop the link below in the description box. It's a 3-hour, like I said, it's a 3-hour audio, 3-hour video, and it's like a 45-page study guide that goes along with it to tell you the basic foundation of risk adjustment coding, the most commonly used diagnoses in risk adjustment coding. And now it's actually on sale. I think it's like either $29.99 or $34.99. I'm not sure, but it's one of those. And I will be making also an upgraded version just to add new codes and new risk adjustment common diagnosis as well. So let's get into it. So when you're studying for the CRC, these are the things that you will need to know. This is what's on the exam. So during the first chapter, it's called The Business of Medicine. And usually that's going to be in your CPC book or any other, your CPMA book if you're studying for your auditing. So it's always the first chapter when you're learning to code because medicine is business. And also it gives you more information about your role as a coder. It lets you know about providers, different payers, the expectations that you should have from your providers when it comes to coding. Because as you know, as coders, we kind of act as an auditor for our physicians or our clinicians. Because they put a code on a chart, that does not mean that that's the correct code. A lot of times these physicians or these clinicians will pick the code that appears to be similar to what they're looking for. However, a lot of clinicians and providers do not know all of the coding rules in detail, where these codes don't go together, or this is an excludes one. You can't use this one and this one on a claim. So as a coder, you're acting basically as an auditor to the physician or the clinician to make sure that the appropriate codes are on the chart, and also to make sure that the diagnosis matches the medical documentation. So that's kind of like the first chapter that you'll learn, the business of medicine, learn about your job, your role as a coder, how do you fit in with clinicians and physicians, also about medical necessity. Medical necessity is very important to know about, because a lot of times Medicare, Medicaid will not pay for certain procedures or certain things because it's not a medical necessity. If it's not a matter of life and death, or a matter of medical necessity being necessary to sustain this person's quality of life, then it's usually paid out of pocket, or however it's paid, it's a bill accumulated, whatever it is, they usually don't cover things that are not medically necessary. So you'll also learn medical terminology and anatomy. So medical terminology and anatomy is very, very important to medical coding. And the reason it's very important, because if you do not understand the medical terminology, if you do not understand anatomical sites or anatomy or things like that, and it's going to be harder to read medical charts because you do not know where to start. So also, I am in the process of creating a 4-week, it's going to be completely online. So I'm in the process of completing a 4-week medical terminology course. It's going to be an anatomy. It's going to be 2 weeks full of medical terminology and 2 weeks full of anatomy. If you get the basic foundation of medical terminology, it makes it easier. Not easy, but easier as you go into your coding journey. So you'll also learn about ICD-10 codes. Of course, that's very important with risk adjustment coding. So along with the business of medicine, along with medical terminology and anatomy, then you're also going to have a specific session about ICD-10 coding. That's going to be very important. Not only are you looking to match the code to what the question is asking, you need to know the rules. You need to know how to know what codes don't go together, how to know what codes, how to learn about which codes do go together. So the ICD-10 session or section is very important also to risk adjustment coding. Then we're going to get into risk adjustment models. There are several risk adjustment models. There's a CMS model, and we know CMS stands for Center for Medicare and Medicaid Services. There is a HHS model, which is Health and Human Services. There is a HHS model. There is the Medicaid model is called Chronic Illness and Disability Payment System, CDPS. That is the Medicaid risk adjustment model. If you look at jobs who are hiring for risk adjustment coders, then you will see they ask you, do you know how to do Medicaid or Medicare risk adjustment charts or risk adjustment coding? Because it is different. So when you're learning or when you're studying for the CRC or HCC coding, then you do need to know the different risk adjustment models. Another thing that I always tell people is, that coding in real life is totally different from the information you need to know to pass the exam. A lot of these things that you will learn in the course, or a lot of these things you will learn from studying risk adjustment coding, you do not need to know in real life. It's a difference between information that's good to know and information that you need to know. So the different risk adjustment models, it's good to know, but you don't need to know all of these things as far as about the different risk adjustment models in your everyday life as far as coding on your job. So we'll talk about the different risk adjustment models. That's a different section. We'll also talk about predictive modeling in quality care. As you know, risk adjustment coding is totally different from fee-for-service. And we know that fee-for-service is every time you go to the doctor, every time you get a service, there is a fee. Well, risk adjustment coding, it focuses more on the quality of the care that you're receiving from your provider. That's why in this model, and as you guys know, I work for a risk adjustment company. So within this model, the quality of care is more important for the patient than the quantity of the care that they're receiving. So that's why if they're meeting certain measures, as far as in the risk adjustment model, then there's usually a bonus incentive at the end of that year for that company if they've met all of the quality care measures. If they've rated at least a 4 out of 5 stars, then there is a quality bonus incentive, and that also gives the company, the clinicians, everybody who works for that company, it gives them an extra incentive to make sure that they are taking care of the patient, that they're focusing on the quality of the care and not just the quantity of the care that they're giving a patient. Because if they meet certain measures, they're going to get a bonus. If they don't meet certain measures, they can lose their contract with Medicaid or Medicare, and you won't receive the bonus. So quality care is a lot of the focus with risk adjustment coding. Also, predictive modeling. What predictive modeling is going back and looking at an overview, and it could be like a couple of years, looking at an overview of your records, an overview of your claims. So, as we know, every year your risk adjustment score starts over. It starts over unless you have things like an amputation. Amputations don't go away. So that's something that's, of course, is going to roll from one year to the next year, just to capture that on the claim again, because your amputation is not going to grow back. So you're going to always have that once you have it. There are certain diseases like once you have it, you're going to always have it. HIV is one of those as well. Even if your viral load is undetectable, you still have the disease. So that's something that'll roll over into year after year. So although our risk adjustment score starts over every year, there are several diseases that you cannot get rid of. So they just roll over, and you just have to make sure you recapture them on the claim because you know that they're going to be here the next year. So what predictive modeling does is, if I can see what was going on with you in 2019, look at all your claims, look at your risk score. 2020, I can look at your risk score, your claims, your things like that. 2021, I can go back and look at your claims, every doctor visit, every diagnosis, every procedure. Predictive modeling, what that does is, if I go back and look from 2019, 20, and 21, that kind of gives me an idea of what's going to go on with this patient in 2022. That's what predictive modeling is. Predictive modeling is basically predicting the future health status of this patient going by the previous claims data. So again, the higher the risk score, the sicker the patient is. The lower the risk score, the healthier the patient is. And a lot of insurance companies, even commercial now, they're leaning toward this risk adjustment model because it does it does save money. It keeps down fraud. Because listen, if a patient has a low risk score, that means that this patient is generally healthy. So if I'm looking at the claims data and I see that this person has a generally low risk score, and then when I look at all the medical records and the information, and it says that this person has had an MRI, they had x-rays, they had all of these different kind of procedures and things done, but their diagnosis and their risk score doesn't support it. So it's like, this person is generally healthy. Why are you spending all of this money with these diseases, with these diagnostic testing and things like that when it doesn't show that the patient needs this? So are you stealing money from Medicaid, Medicare? Like, what are you doing why are you just giving this patient a test when their score doesn't meet or doesn't say that they're as sick? So it also, predictive modeling also can keep down fraud, things like that, because it predicts the future health status of this patient. Also, you will learn about the quality payment program. You remember I was telling you about 4 out of 5 stars. That's how you get a bonus or get an incentive or things like that. So we'll go into the quality payment program and what it takes to get the quality bonus. Also, we'll talk about how risk adjustment relates to medical financial matters. Yes, it's healthcare. Yes, it's medicine. Yes, it's medical related things. However, money is still involved. You need to know everything about the finances because that's what drives this model. We'll also talk about diagnosis coding and documentation. Documentation is very, very, very important. You as the coder, you're responsible for making sure that the physician documents properly. If you're going to use certain codes on a chart, you have to make sure as the coder that the documentation supports whatever code that you're using. If the documentation doesn't support, when your company gets audited, your company may owe money to Medicare, or they may owe money to Blue Cross, Aetna, United Healthcare, whoever is your payer. Because if you're putting diagnoses on the chart and it's not accounted for, then it means they paid you for something that they shouldn't have paid you for. So they're going to want a refund. So medical financial matters is very important to the risk adjustment model. We're talking about diagnosis, documentation, and coding. We'll talk about data collection sources. So what I mean by data collection sources, when we're calculating the patient's risk score for the year, and that's called a RAF, R-A-F, risk adjustment factor. That's the score that they're going to receive. So when you're data collecting from different sources, you're going to use the data from the emergency room, the primary care doctor, any specialist they've went to, any mental health, any place that they visited that's an approved specialty type, then that's going to be the place where they're going to look at all of this information in order to calculate a score. So there are different data sources that you would collect the data from. Also, we'll get into a little bit of evaluation and management coding. If you're not familiar with that, then that's E&M coding. So every time you go to the physician's office, if you go to the gynecologist or the primary care doctor or whatever it is, then that's E&M. That's an E&M visit, evaluation and management. So let's say you're coughing, like I'm doing. Let's say you're coughing and you call your doctor's office, hey, I'm coughing, I need to come in and make an appointment. So your chief complaint or your reason for the visit is because you are coughing. So for your E&M visit, your evaluation and management, what that doctor is going to do is they're going to evaluate you, and then they're going to manage what they've evaluated. So we'll talk about that as well, because there are different levels to E&M coding. There are different levels, and level 1 means is you may come in with a scraped knee or something like that. That's a level 1 visit. And the money that the doctor's office or the clinician or the practice is paid is paid by the level that you're at for your visit. The lower the level, which means nothing is really wrong with you, the less money that this practice or this doctor's office receive. And E&M leveling is in a fee-for-service model, but it's still information that you would need to know in order to understand things about risk adjustment coding. So a level 5 at a doctor's, if you go to a doctor's office and they code your visit as a level 5, that means you are dying. That means they need to get you out of that doctor's office via ambulance and transport you to the hospital. So you're rarely going to see level 5s in an E&M setting. And if you use level 5 a lot, that's grounds to get audited. Because if these people aren't dying in a doctor's office and they don't need immediate attention, life or death attention, it shouldn't be coded as a level 5. Keep in mind that the higher the level, the more you get reimbursed. So a lot of times people were using level 5s just to get that reimbursement, but it will come back to bite you because they'll want their money back if you ever get audited. So we'll talk about coding from lists as well. When you're reading your medical chart, you have a problem list. You have the HPI. You have the assessment and plan. You have a lot of different elements of the medical record. So with risk adjustment coding, some of these elements you can code from, some of these elements you cannot code from. So it's going to be very important to retain and do this information because, as you know now, the test is shortened. At first, before January the 1st, you could miss 45 questions. Now you can only miss 30 and pass. Used to be 150 questions on the exam. Now there's only 100 questions. They used to give you almost 6 hours to complete the exam. They've shortened it into 4 hours. So out of the 100 questions that's going to be on the exam, you cannot miss anything but 30. So all of this information is going to be very, very, very important to make sure you retain, write good notes in your books and things like that. So another thing that you'll learn under diagnosis, documentation, and coding is the different elements of the chart, the different elements of what a physical exam or what a visit consists of, or what's the expectations of a visit. For example, you have review of systems. So that's something when a physician examines, the patient, and they review the systems. They're gonna, and then the leveling, we talked about E&M leveling, sometimes or prior, because there's new rules now, it used to be contingent upon how many systems were reviewed. The more systems that were reviewed, the higher the level was, depending on what they found in those systems. So review of systems means that the physician may review my cardiac system, my lymphatic system. They might review my urinary system. So review of systems is just reviewing your body systems and seeing what's going on according to what you told them what was wrong. So also, we'll talk about clinical documentation barriers in this in risk adjustment. It has a section for that. And what I mean by clinical documentation barriers is if the date of service is missing on a chart, if the provider's credentials is missing, because as you guys know, and if you don't know, I'm telling you now, with risk adjustment coding, you have to have an approved provider. A RN, I cannot code from an RN's chart in a risk adjustment model. Cannot. I can code from a physician assistant, nurse practitioner, MD, DO, not a RN. So what I mean by clinical documentation barriers, we have to make sure that the signature is present on the medical chart. We have to make sure all of the elements are there. Make sure we know the specific coding clinic guidance when it comes to coding the charts. And lastly, the last section that you will learn about in this risk adjustment model in regards to passing the exam is frequently coded conditions in the risk adjustment model. So as I wrap up this video, I'll just go through a few conditions, just to name, that are very important to the risk adjustment model because it has a risk adjustment score. As you know, risk adjustment coding, you're only coming out of the ICD-10 book. No CPT book, no HCPC book, no other book other than ICD-10 book. And that's another reason why I like risk adjustment coding, because I don't have to use all of these books that we normally use as coders to find the answer. I'm only using one book. So with that one book that I'm using, all of those codes in the ICD-10 book does not have a risk adjustment score. So although I'm only using one book, I'm still only using a portion of the codes in that one book. So it kind of narrows it down. It gives me an opportunity to kind of hone in on my skills and kind of like focus in one area to get like super excellent in one area, because I'm not all over the place in all these different books. I'm only coding out of one book. So as I wrap this video up, frequently coded conditions in risk adjustment models that you will learn about. You're going to learn about COPD, emphysema, asthma, complications of care, congestive heart failure, depression, dementia, DVT, which is deep vein thrombosis, hepatitis, GI issues like GERD, HIV, heart attacks, of course, cancer, epilepsy, convulsions, migraines, pulmonary embolism, rheumatoid arthritis, neuropathy, pneumonia, varicose veins, ulcers and wounds. That's going to be important too. Substance abuse, and also vertebrae fractures. So those are just a lot of the common coded or frequently coded diagnoses in the risk adjustment model. So I'm glad you came by. Don't forget to like, comment, and subscribe or whatever for the video. Also, we have some big things going on. As you guys know from the last video, or if you follow me on other platforms, I am the AAPC's Atlanta chapter president. So we have a lot of major things coming up. I will also drop a link in the video to let you know we have our first speaker of the year. It's going to be later this month. I'll also let you know when. It's going to be an MD. He's coming in. He's going to talk about a lot of coding things for us that's going to be helpful for us to learn from. So I'll also let you know everything that's going on with the Atlanta chapter, so you guys can join us and just have an array of knowledge with what you already have. So again, thank you for joining the video. Of course, you can follow me on IG, which is MJ the Coding Coach _CPC. On Facebook, it's Dynamic Medical Billing and Coding Group. And of course, you're already here on YouTube with me now. So go ahead. Don't forget to comment, like, and subscribe. And if you have any questions regarding CPC, CRC, medical coding, or anything like that, make sure you drop your question down below. in the comment section. I'll get to your question as soon as possible. Again, I'll drop those links for the other platforms, and I'll also drop that link for the pre-employment risk adjustment study guide video. Again, sometimes you don't want to spend $1,500, $2,000 to jump into something to be totally committed if you're not sure that you're going to follow through. So for about $35, you can get the risk adjustment video, you can get the risk adjustment study guide, and you can kind of see if this is something that you are interested in to want to go further with coding in this certification lane. So thank you so much. I hope you guys enjoy the video. Don't forget to drop your questions down below, and I will see you next time. Thank you so much.